So welcome, everyone. Thank you so much for joining us for the third session of the New Frontiers webinar series. We're really excited to have you here. My name is Lora Iannotti, and I'm a professor of public health at Washington University in St. Louis. I'm founder and director of the E3 Nutrition Lab and director of planetary health and environmental justice for the new Center for the Environment, just recently launched. Today, we are thrilled to host a good friend and colleague for many years, Dr. Stephanie Martin, who will be presenting on factors that influence adolescents' diet and physical activity, mixed methods research from an informal settlement in Kenya. Today's session is part of a large webinar series titled New Frontiers to Prevent Diabetes and Malnutrition, Opportunities for Global to Local Impact. The series, which is co-sponsored by my lab and CDTR, asks leads in the field, like Stephanie, to share the latest perspectives on public health opportunities to inform the prevention of diabetes and malnutrition, including obesity and undernutrition. So we have just a few housekeeping notes before I introduce Dr. Martin. We will be recording today's session. The recording will be available at the WashU CDTR website. If you have questions during the presentation, please add them to the Zoom chat, and we will plan to address these during the Q&A session at the end. So now it is my pleasure and honor to introduce Dr. Stephanie Martin. She is an assistant professor at the Department of Nutrition in the Gillings School of Public Health, Global Public Health at University of North Carolina, Chapel Hill. Her research focuses on design, implementation, and evaluation of social and behavioral interventions to improve nutrition during pregnancy, lactation, and childhood. In addition to her research in Kenya, Dr. Martin is currently examining interventions to improve infant and young child feeding in Ethiopia, Tanzania, and Zambia. She also conducts nutrition implementation research in the US and Zambia. Before joining UNC, Dr. Martin worked for 13 years, some of those years with me, as a global health practitioner, implementing policy, facility, and community-level health and nutrition programs. So we welcome you, Stephanie, and I turn it over to you. Thank you.
Thanks so much, Laura, for that introduction, and thank you for inviting me to present our research from Kenya. Get my slides. Here we go. All right. Well, thank you, everybody. I'm really excited to have the opportunity to share our research with you today. I haven't had a chance to talk about all the phases of this research in one talk, so this was exciting for me. I wanted to start off by talking about my collaborator and partner in this research. I work very closely with CFK Africa, which was formerly Carolina for Kibera. CFK Africa is a community-based organization that has worked with community members to improve health, education, and economic outcomes in informal settlements in Kenya and East Africa since 2001. And they have just been a wonderful partner for this work. And I wanted to highlight all of the people who've worked on these different research projects over the past 4.5 years. And here are several members of the team in Kenya, as well as acknowledge my colleagues here at UNC. So through conversations with CFK several years ago, we decided that it was important to explore the double burden of malnutrition in Kibera, an informal settlement in Kenya. And the double burden of malnutrition is characterized by the coexistence of undernutrition, and that can include wasting, stunting, short stature, underweight, micronutrient deficiencies, and overweight, obesity, or diet-related non-communicable diseases. And these can exist within individuals, households, and populations, and across the life course. This map shows countries experiencing different forms of malnutrition at the population level. The orange represents high rates of overweight and anemia among women, as well as stunting in children. Countries in Africa are most affected by these multiple forms of malnutrition, as you can see from this map. Over the past several decades, food environment changes have increased access to energy-dense foods and beverages and contributed to rising rates of nutrition-related non-communicable diseases in Africa. This nutrition transition is occurring alongside rapid urbanization. Sorry, I'm having a small problem with my Zoom. There we go. And rates of overweight and obesity are higher in urban areas and also higher among women. To address women's increased risk for all forms of malnutrition, it's especially important to focus on adolescent girls. Adolescence is an opportunity to establish healthy habits and reduce later risk for non-communicable diseases. And adolescent girls in low and middle income countries face a disproportionately high risk of overweight, obesity, and micronutrient deficiencies. Their diets are often low in fruit and vegetable intake and high in energy-dense, low nutrient foods and snacks. There's limited evidence of effective interventions to address all forms of malnutrition among adolescents in low and middle income countries, and this is especially the case for informal settlements. So more than 1 billion people around the world live in informal settlements, and this is a picture of Kibera, an informal settlement in Kenya, where we did this research. Informal settlements are densely populated and often have high rates of poverty, inadequate housing, a lack of water and sanitation infrastructure, and high levels of unemployment and high crime. In Kenya, 70% of urban residents live in informal settlements, and Kibera is the largest. It's estimated to have between 300 and 700,000 residents and is one of the largest informal settlements in Africa. Kibera is a vibrant and dynamic community, but this environment can also negatively influence adolescent girls' diet and physical activity. Our goal with our research was to conduct formative research to identify specific factors that influence adolescent girls' diet and physical activity in Kibera, and then use that information to inform the design of appropriate and effective interventions. Formative research is preliminary research that's done to understand a context and to help inform intervention design. It's often done at a small scale. It can use qualitative, quantitative, or mixed methods, and it's exploratory rather than hypothesis testing. So for our research, we used a mixed methods design, and in our first phase, we conducted a food environment assessment, and the blue represents the quantitative analysis that we conducted. And then in the second phase, as part of our iron deficiency and anemia among adolescents, or IDEA study, we used mixed methods. And so the teal is showing the qualitative analysis that we did. So first we started with free lists, then we conducted a survey, and then we followed up with focus group discussions with pile sorts. And then in our third phase, which is the school nutrition and activity in Kibera, or SNAC study, it was entirely qualitative to follow up on the findings from the second phase, and we conducted focus groups and interviews. For our first phase with this food environment assessment, our objective was to characterize the food environment based on characteristics and spatial distribution of food vendors. We collected data from 456 food vendors in Kibera. This was almost all of the vendors in Kibera. We collected their GPS location and then categorized the type of vendor, whether they were a hawker, if they were selling from a kiosk, a stand or a table, a market stall, or a small restaurant. And then we also categorized the types of food and beverages that vendors sold. So this map shows the villages in Kibera in blue, and then the vendor type from yellow to dark red, and just sort of shows the variety of vendors, but also shows that they're following along sort of lines and paths and roads that are commonly traveled in Kibera. This next map shows the types of vendors based on the category of foods sold. And we used an obesity risk categorization scheme by Kroll and colleagues, but this shows the lighter the circle shows vendors that are selling nutrient dense foods. So those are selling mostly fruits, vegetables, legumes, and mixed dishes. And so the next one is a slightly darker yellow color, represents vendors who are selling a lot of nutrient dense foods, but also sold other kinds of foods as well. Whereas the orange color are mostly energy dense foods, but selling some nutrient dense foods. And then the red are vendors that were selling only energy dense foods. And you can see that there was a considerable variation, but also that the darker red vendors tended to be clustered together. And so from our food environment assessment, we found that the food environment was characterized by the availability of a large number of energy dense, low nutrient foods alongside nutrient dense foods. 44% of vendors sold nutrient dense foods, and 34% sold energy dense, low nutrient foods. So there's access for residents of Kibera to all different kinds of foods. But we did notice that the clustering of vendors selling energy dense foods, and sort of thinking about what that means for designing environmental interventions in terms of what people have access to. For the second study, it was the Iron Deficiency and Anemia in Adolescent study, or IDEA. And this, we used a mixed method sequential explanatory design. So we started with free listing, and during structured interviews, we asked mothers, food vendors, and adolescent girls to list all of the foods that adolescents in Kibera eat. And this was important for us to make sure that we had an accurate sense of all the foods that adolescents were eating, and to make sure that we were including them in our survey, as well as in the pile sort activity that I'll talk about next. After the free listing, we conducted a cross-sectional survey with older adolescent girls, ages 15 to 19. And as part of that survey, we collected 24-hour recall as well as food frequency data. We collected anthropometry, weight, height, and waist circumference. We also took a blood draw to be able to measure hemoglobin and ferritin so that we could assess iron and anemia status. And then we asked about physical activity using the Global Physical Activity Questionnaire, which had been previously adapted for Kenya. After the survey, we conducted focus group discussions with pile sorts, and those were done with adolescent girls 15 to 19 as well. To measure diet quality, we used categories from the Global Diet Quality Project. And this included the Minimum Dietary Diversity for Women scale, which allows you to determine the proportion of adolescents who consumed at least 5 out of 10 food groups to reflect minimum dietary diversity. We also calculated a food group diversity score, so looking at the number of food groups that adolescents consumed. And then we used the NCD Protect and the NCD risk scores, and those are derived from 9 healthy food groups. So asking if categorizing foods that adolescents ate, whether they had whole grains, pulses, nuts and seeds, vitamin A rich vegetables, leafy greens, other vegetables, vitamin A rich fruits, citrus and other fruits. And then also asked about food groups and drinks that should be limited or avoided, such as soft drinks, baked sweets and other sweets, processed meat, deep fried food, fast foods, and ultra processed salty snacks. And then the Global Dietary Recommendation Score is derived from subtracting the NCD Protect score from the NCD risk score in order to be able to determine their overall, how well they're adhering to dietary recommendations. And so for the NCD Protect score, the higher the score, that's the more number of recommendations that have been met. And for the NCD risk score, a lower score reflects more recommendations being met. And the NCD risk score is also can be used as a proxy for the consumption of ultra-processed foods. So now I'll talk about the part I think is the most fun, which is these focus group discussions with pile sort activities. As part of the focus groups, we asked participants to talk about concerns they had related to nutrition, their perceptions of adolescents' overall health and nutrition status in Kibera, their access to foods, their interests in cooking and gardening. But then we also asked them, we gave them printed cards with pictures of food, one food item on each card, and asked them to categorize those foods based on, first we had them create their own food groups. Then we asked them to divide them by foods they thought were healthy or unhealthy. And then last, we asked them to divide them by foods they eat and foods they do not eat. So from our survey, we surveyed 313 girls. The mean age was 17 and a half. 80% of them were enrolled in school. 14% had a child. Among those enrolled in school, almost 80% ate a school-provided lunch, and 37% reported moderate or severe household hunger, so more than a third of the participants in our survey. And we found that girls with obesity had higher rates of moderate or severe household hunger compared to those who did not. In terms of nutritional status, more than 50% of girls had at least one form of malnutrition. So you can see that 6% were either underweight or short stature. 10% had iron deficiency or iron deficiency anemia. Another 10% had anemia, but it wasn't caused by iron deficiency. 20% had abdominal obesity, and 11% had 2 or more forms of malnutrition. And for the 11%, the most common was coexisting abdominal obesity and undernutrition. And so it just was really interesting to see these results, because I think going into this study, CFK and our larger research team wasn't really sure what we would find here. And so this was really helpful to have these results. We also found that similar to other settings in low and middle income countries, that adolescent girls' diets lacked diversity. Only 7 girls in our sample of more than 300 met the minimum dietary diversity requirements, so only 7 consumed 5 out of the 10 food groups. In terms of the mean number of food groups consumed in the previous 24 hours was only 2.6. Most of the participants consumed grains and dark leafy greens. The NCD risk score was low and the NCD protect score was low. And so it was, I think one of the good things about their diets is a lot of girls aren't eating ultra processed foods. And so that's not really showing up in these data. But there is a lot of consumption of deep fried foods, which are the most common of the NCD risk foods. And we also found that girls with moderate or severe household hunger actually had more diverse diets. And that's something I'll talk a little bit. We were able to look at that a little bit more through our qualitative research in the 3rd phase. But there were no other differences by sociodemographic characteristics in terms of girls' diets. And just to give you a sense of what their diets looked like using the 24-hour dietary recall data, we found that it was common for girls to eat ugali, which is pictured in the upper left-hand corner, which is a stiff maize porridge, or porridge, which is behind it, to eat those along with greens, or it was common to eat a bean and corn stew that's in the bottom middle. For some girls, they were able to eat purchased fried snacks. And so that's what's on the far right-hand side. And then it was also common to drink tea, but I realized we made these pictures before we collected our data, and more common for the participants in our sample to drink tea without milk, but tea with sugar. Milk is more expensive, and so not as common. From our food frequency data, we were able to get a better sense of the kinds of foods that adolescent girls are eating throughout an entire week. And so this just shows some of the foods that were commonly eaten during that time, but it also really highlights, you can see that it was very, very uncommon for girls to eat any fruit, and the vegetables that they ate were leafy greens or cabbage. But having both the 24-hour recall and the food frequency data were helpful to be able to capture more diversity with the food frequency questionnaire. And then it also corresponded to what we saw from their responses during the pile sort activities. In terms of physical activity, walking was the girls' main form of transportation. More than 80% of girls walked to where they needed to go. And more than half reported walking amounts that met the WHO weekly physical activity guidelines. However, recreational physical activity was uncommon. Only 14% participated in recreational physical activity more than one day each week. And more than 20% reported almost no recreational physical activity during a week. And we didn't see any differences in physical activity by sociodemographic characteristics. So from this second phase, we were able to conclude that there was a community level double burden of malnutrition. I think it was really striking that 57% of girls had at least one form of malnutrition. And we also noticed a dietary double burden. So their diets were low in iron-rich foods, they were low in dietary diversity, and they were low in the NCD protect foods. We saw that there were high levels of physical activity for transportation, but recreational physical activity was uncommon. And from the focus group discussions, we heard from girls that they wanted to eat a balanced diet, but they faced many barriers, namely financial. And these results really highlight the need for double duty actions. WHO talks about double duty actions as those actions that can both prevent undernutrition as well as overweight, obesity, and non-communicable diseases. And so that need for thinking about the kinds of interventions really led to our next phase of the research that we did, which focused on schools. Through our focus group discussions and conversations with CFK and other stakeholders in Kibera, it became clear that focusing on schools would be a way to potentially improve adolescent diet and physical activity. CFK has been working in schools for more than a decade and has programs in schools that focus on adolescent reproductive health and economic development. And so it would provide a platform to integrate nutrition into their ongoing activities. And so through our School Nutrition and Activity in Kibera, or SNAC project, we used the findings from our second phase of research to really try to focus on what we needed to know in order to be able to ultimately design an intervention. And we conducted focus group discussions with adolescent girls and boys. Even though our focus is on adolescent girls, if the intervention is going to be delivered through schools, it would be for all students. We also talked with parents and guardians of adolescents to get a sense of what their priorities and experiences are, as well as with school teachers. And then we had key informant interviews with school administrators, as well as healthcare providers in Kibera. And we analyzed these qualitative data as well as the previous qualitative data that was done jointly by analysts at UNC and CFK, and we conducted thematic analysis in Atlas TI. And we are using this simplified model by Lytle and Myers that provides a food environment conceptual framework for child and adolescent obesity. And this really illustrates how the physical food environment and social environments indirectly and directly influence adolescent obesity risk. From our findings in the second phase of the study, we with the focus groups, what we found really mapped on nicely to this framework. And so we used it to inform the design of our qualitative work in the SNAC study, and then also used it throughout our analysis. So at the macro level, we found that a lack of financial and employment opportunities and high levels of poverty substantially influence adolescent girls' diet and physical activity, as do social and gender norms. And we also heard from parents and from adolescent girls that safety and security concerns restrict recreational physical activity. And then throughout the focus group discussions and interviews, we heard that the lack of government investment in adolescent nutrition and physical activity was a real issue and something that they hope will be addressed. In terms of how poverty influences what adolescent girls eat, this quote from a parent of an adolescent really highlights the challenges they face. She says, "We tend to just eat what we come by. We do not have a plan that this time we will eat this, and when that time reaches, we will eat that. If I'm blessed to get vegetables or kale, I will cook them, but maybe I do not have onions or tomatoes, so eat them plain with ugali, which is the staple of stiff maize porridge, and drink lots of water. Here in this place of ours, there is no healthy eating. We eat what comes our way." In terms of gender differences, an adolescent girl talked about some of the gender differences and safety concerns that girls experience, as well as expectations for girls around housework that are different than boys. She said, "Boys can play sports after school from 5 p.m. to 7 p.m., but as a girl, you cannot leave the school at 7 p.m. The boys stay until 7 p.m. because they can protect themselves. Your parents won't allow you to leave school at 7 p.m. when there are dirty plates waiting for you at home. You are supposed to cook and do your homework." And this quote really shows these sort of two different issues that adolescent girls experience that are different than boys in terms of, it gets, since Kenya's on the equator, it gets dark usually between 6:30 and 7. And so walking home in the dark in Kibera for an adolescent girl would not be considered safe. And then the other thing is the chores that she would be expected to do prevent her from being able to stay late at school and participate in physical activity. And we heard a lot from parents and from students about having to balance physical activity and wanting to do and their homework, and as well as both outside of school and within school. In terms of the physical environment, participants talked about high food costs, the inability to have a garden, both because of a lack of space and concerns about theft. We heard participants talk about how there had been efforts in the past to have community gardens, but people who were not part of the community garden would come and take the produce before they were able to harvest it. And so it was a concern around ways to practice gardening in a way that felt like it would be safe for them. They talked about how school meals lack diversity. This is something that the adolescents talked about a lot. There was a high level of knowledge on balanced diets and what kids should be eating, but a lot of them talked about eating the same bean and maize stew every day. And so really highlighting that lack of diversity in terms of school meals. And then students also talked about food safety and food hygiene concerns, both at school and from street vendors. It was something that they were very aware of and paid a lot of attention to, and influenced their choices as much as it could as they balanced financial considerations. And then they talked about a lack of space and equipment for physical activity at school and in the community. And this was something that was talked about by parents, teachers, and adolescents. This one adolescent boy talked about concerns about food safety. He said, "There's a lady who prepares chapati. She is located next to the sewer and flies come from the sewer and land on the food. There is no form of cleanliness at all. And there were many, many quotes about students talking about their concerns around food safety. In terms of the physical environment, parents often talked about the lack of space for kids to participate in recreational physical activity. As this parent said, on the road meant for cars and motorbikes, that is where they play football. There is no space to play. They play in the road. In terms of the social environment, adolescents' diet and physical activity behaviors were very much influenced by family finances as well as priorities. Parents worried about adolescent screen time, sedentary behavior, as well as diets. And this was something that was a little bit surprising because when we started this project a few years ago, there was we weren't sure how much of a priority. We knew that there was a lot of concern about undernutrition, but we weren't sure how much of a priority overweight and obesity would be among the parents and the students. And so it was interesting to hear them talk about these concerns. And we also heard from parents that they want to be involved in their children's health, and adolescents really want them to be involved as well. Teachers and health workers were seen to be trusted sources of health information, and relationships with food vendors influence food purchases. And so sometimes adolescents would talk about vendors who would either allow them to purchase something on credit, and so they would purchase from that food vendor, or also, how they make choices between food vendors who they perceive to be have higher levels of food safety and hygiene, would be more expensive, and sort of how they make those decisions between what they purchase. And then they talked about friends and peer pressure and how that influenced food purchases. One student, when talking about peer pressure, said, for example, the way we are here as a group, one person can just suggest that we eat this, and then it is supported by the majority, so you are forced to buy it. In terms of family priorities and just their experiences overall, or their circumstances overall, one parent talked about how these children are left doing household chores because the parents are going away to work. So it is the children who are left to do chores, and they do not get to do enough exercise. In terms of individual factors, we found that adolescents were very knowledgeable about the importance of a balanced diet. They were able to talk about different food groups. They were able to talk about different nutrients. So there was a high level of knowledge. There was also a real desire to be able to eat a balanced diet and to participate more in recreational physical activity. There were issues around self-efficacy for healthy eating and physical activity. Adolescents talked a lot about hunger and food insecurity and how that influenced their schoolwork, their dietary practices. It was the most common. We had our weekly meeting with the team, the qualitative analysis team in Kenya and in North Carolina this morning, and we were just looking at our codes, and over the code that was the most commonly used in our analysis was related to hunger and food insecurity. And so that's something that was really at the top of everyone's mind throughout all of these conversations. And related to that is purchasing power and how that influences diet. Then the lack of sports equipment and clothes and how that prevents adolescents from being able to participate in recreational physical activity. Individual level concerns about safety, and then feeling like they don't have enough time. And that was something that a lot of the adolescent girls talked about, was sort of balancing a desire to have time for physical activity, but also having a lot of responsibilities at home as well as a lot of homework. One parent said, so this quote is very related to some of the information I presented earlier, where we saw that adolescent girls who had higher levels of food insecurity actually had a more diverse diet. And that's because those adolescents were eating leafy greens. And for people who had more household assets and therefore less food insecurity, they actually chose not to eat leafy greens and would purchase fried snacks and other snacks rather than eating leafy greens at home. And so those that is what we think explains that relationship. And so this parent describes that by saying, when their financial situation improves, they will not eat greens at all. So when they're struggling, at least they get to eat some greens. And then in terms of girls' comfort participating in physical activity, it was something that came up a lot and was talked about by adolescents, both boys and girls, as well as their parents and teachers. And one adolescent girl said, "I'm not used to running. I fear what people will say about me when they see me running." And so I think as we're designing interventions, it's important for us to think about how self-efficacy factors into the interventions we're designing. We asked participants from all of the different categories of participants who either were in a focus group discussion or were in an in-depth interview what their suggestions were for designing interventions to promote nutrition and physical activity in Kibera. And overwhelmingly, and of course, we interviewed teachers and school administrators, but everyone agreed that there needed to be more school-based activities to promote nutrition and physical activity, both by incorporating more activities into the curriculum and providing opportunities for extracurricular activities. Among the students, among the adolescents, there was sort of an overwhelming desire and push for improving school meals, both as it relates to serving more fruits and vegetables, as well as ensuring food safety. This was something that was really salient in the interviews, in the focus group discussions with adolescents. And then adolescents, their parents and teachers all agreed that parents, guardians, and other family members need to be engaged in school-based activities that promote nutrition and physical activity. They suggested having gardens at school, and by having the gardens at school, that could be a way to address some of the concerns around theft, as well as challenges with space. There was a lot of interest in being part of cooking classes that included nutrition education with specific information on how to cook and prepare meals with a limited budget. And then also creating opportunities for recreational activities that the entire family could participate in. So dances, fun runs, those were some of the examples that participants mentioned. Oh. So from this, we really found that adolescents want to eat a balanced diet and participate in recreational physical activities. And this was also something that we heard from parents and for teachers, that this was a priority for them as well. However, they face considerable environmental and individual barriers, and it really highlights the need for contextually appropriate multi-component interventions. A lot of our findings are similar to challenges that are faced in low-income populations all around the world. I think some of the things that make this setting unique is the physical environment, in terms of really not having space where kids can participate in a recreational physical activity in a safe way. And the other issue is for the students in Kibera who are going to school in Kibera, they tend to go to informal schools. So there are government schools, informal schools, and private schools. And informal schools are not necessarily regulated in the same way. And so a lot of the challenges with the informal schools, as they provide lunch to students, or students' parents pay for them to provide lunch, And that really is something that's different, let's say, from the United States, where we have a school lunch program. And so I think that's something that we're trying to spend some time thinking about. We're in the process of planning to go and do in-depth interviews with the school cooks to get a sense of what their experiences are like and what challenges they face in terms of trying to provide healthy meals for students. It was interesting that the students had a lot of criticism of the school lunch, whereas the teachers and administrators talked about school lunch in a positive way, though they recognized challenges with only providing lunch to students whose families paid for it, and then trying to use any leftover food to provide lunch to students whose families weren't able to pay. But I think there's it's important to sort of understand what things are unique about this context in Kibera, which is similar to many informal settlements, certainly throughout Kenya and in other countries around the world. For our next steps, we're in the process of planning participatory dissemination activities to participants as well as key stakeholders in Kibera and in the county. And we're also, through our conversations with taking what we've learned from our focus group discussions and our survey data in terms of what the priorities are for interventions to improve adolescent nutrition and physical activity, we've been working with CFK together to identify potential intervention components that we could try to test out in different schools in Kibera. And so we're going to have a process with our community advisory board to try to refine those interventions and make sure that they're appropriate for the context. And then we're hoping to test those interventions in schools in Kibera and other informal settlements in Nairobi. And so this was just a summary of the formative research that we've been doing. And it's taken 4 years for us to get at this point, and we're excited to move forward with starting to think about potential interventions and how we can implement them in schools in Kibera. I want to take a second to acknowledge the funding that we've received for this work. It's really just been wonderful to work with CFK as a partner. They're such a trusted organization in the community in Kibera that it really has made this just a wonderful project to work on with them. And so I also want to thank our funders, and I'm happy to answer any questions anyone may have. Thank you.
Oh, Stephanie, thank you so much. That was just fabulous. A rich presentation full of really interesting information and data that you've collected. I am especially impressed with, the approach to taking formative research, prior to designing interventions, and focusing on a population that in the future is going to be critical in terms of urban poverty and urban density, as well as adolescents. I commend you for choosing that period in the life course to focus on. I think, as you said at the beginning of your talk, not enough attention has gone to that population group. So it's very important. I see we have a question. Daher, would you like to pose that? I'm not sure if it's in the chat. I'm not seeing it.
I was trying to unmute, it wouldn't let me unmute. First of all, thank you very much, Stephanie, for that presentation. Dahia Bart Anderson, I'm an associate professor in the School of Kinesiology at the University of Minnesota. And I teach a learning abroad course in which I take students to Kenya. So I've been there several times. I've been to Kibera, where we focus on the physical activity side of things. And so I have a question for you about your focus groups. When you made the statement that the girls reported that they wanted to eat a balanced diet, and having been in Kenya quite a bit, knowing that their diet is culturally, right, very different from westernized diet. Did the girls define what they meant by a balanced diet, and did they give examples of foods both within the foods that they readily eat and then maybe some that they don't?
Yeah, thanks so much for that question. They did. I mean, they talked a lot about fruits and vegetables. I think that was the main thing, and really focused a lot on fruit. For the girls that we talked to, they really felt like fruit was prohibitively expensive and not something that they would have access to. Maybe bananas sometimes, but everything else was seen as being too expensive, or the quality of the fruit that they would get in Kibera wouldn't be something that they would eat. There was a lot of talk. I think there was a lot of familiarity with food groups and talking about needing to eat carbohydrates and proteins and using those kinds of words to talk about food. And so we felt like, while there was some, there's some variability in knowledge related to what they meant by a balanced diet, it was the way they talked about it was sort of consistent with how a balanced diet was talked about here. So it seemed like, I don't know if I'm answering your question, but yeah, I think, they talked about eating different food groups. There wasn't a lot of talk about things like whole grains, for instance. That certainly wasn't something that came up or was discussed among our participants.
Yeah,
So thank you. Sorry.
Go ahead,
I appreciate your response, and yeah, pretty much that's the response I was hoping that you would give, or expecting, kind of. I guess also thinking about the extra layer of, like, they have just a much more narrow diet in Kenya. And it goes back to when you were quantifying the number of food groups that the adolescents reported eating. And so it wasn't surprising that it wasn't like, set, like 10 different types of foods or whatnot, right? They just don't have, from my experience, access to such a variety of foods. And so I was just kind of curious of, like, how they define balance, because from my also experience, although there aren't as many food groups that are eaten there, that the quality of the food, in terms of, like, it being unprocessed, lots of fresh fruits and vegetables, less fruit, but a lot of vegetables, really, that it seems that there's a lot of nutrient dense foods that are being eaten as a whole. So I just had questions related to that. So thank you for that. Thank you for your response.
Yeah, thank you. I mean, I think one of the things that we saw with the food vendor survey is that there were a lot of fruits and vegetables being sold in Kibera. They just weren't being eaten by adolescents. And the parents that we talked to also, I mean, really, it was a lot of leafy greens and cabbage. But mostly it was, grains and starches, and, to a lesser degree, beans. But I think the financial situation of most families in Kibera just is at a level that makes this very, very difficult.
Yeah. Okay, thank you.
Thanks.
So I see we have Shariki, and then a question in the comments. So Shariki, would you like to go next?
Sure. Yeah, so I really enjoyed this presentation, and was really admiring the detail and care that you put into doing this. So it never hurts to say that, because this is hard work. People don't realize how hard this kind of work is compared to a simple survey. So I have two comments or questions. One is that when you were talking about the self-efficacy for running, what before you said, you were associating with self-efficacy. I thought about it more as social norms and the differences in what cultures think it's appropriate for girls to do. So I just, I thought about that as another possible interpretation, along with, their own, those are related. But the other is because I do study food marketing. I wondered what you were able to observe about the marketing of food in the community in terms of packaged foods or whatever. The vendors were probably selling some version of fast foods, and Coke was probably there somewhere, and maybe even McDonald's. Did you comment on that?
Yeah, thank you so much for your questions and your comment. And I agree about the comment about running. I think is very much tied to social norms and sort of that relationship and how that makes individuals feel in terms of what they're able to do. In terms of the marketing, I was very surprised that there weren't more ultra processed foods being consumed by participants in this sample. And I think it's because of the cost. And so there were a lot of people were eating mandazi, which is like a donut. It is delicious, but they're made by vendors on the side of the road. So there were very little packaged foods actually being eaten. So despite there being a lot of packaged foods, and Coke is certainly for sale in Kibera, they sell and make a smaller size Coke bottle that can be sold for less money to make it more affordable to folks. And that is sold there. So, but it didn't really seem to impact the diet, at least of the girls that we surveyed. And it was surprising to me. And that's why when we looked at the NCD risk score, it was really very low because they were really only eating either the fried mandazi or samosas, which are usually filled with ground beef and fried, or they would have chapatis, which is sort of debatable about how it's categorized, but it's typically made with a lot of vegetable shortening. And so I think there is a lot of food marketing going on there, but we didn't see it being eaten. And I think, a larger survey might capture that in a way that we only talked with 300, around 300 girls. And so we didn't see it. And even in even in the focus group discussions, they talked about some like types of fast foods, but didn't talk about specific brands or companies of fast foods. And it was very surprising because it's definitely being sold there. And there are, at kiosks, there are signs and you can see those foods, but we didn't see it in our sample.
Thank you.
Yeah, I think that's an important question. Certainly see these companies all over the world. Sammy in the chat has a question. First of all, just very positive about the presentation, Stephanie. But the question is, how did you establish connections internationally? Where did you start, and what advice would you give to someone interested in doing D&I work internationally?
So CFK, thanks for that question. CFK Africa used to be called Carolina for Kibera, and it was founded by a Kenyan nurse and a UNC alum who was living in Kenya. And so that was in 2001. And since that time, CFK has had a tie with UNC. It now, and I think for more than 10 years, has had an entirely Kenyan board, and the management and administration is run out of Nairobi. There is a fundraising arm still here in the US, but that really facilitated this relationship. I had lived in Kenya for almost 4 years, about 3 miles from Kibera. And so I also had experience there and had worked on projects in informal settlements. So I think that helped when we were building this relationship. But it was because of UNC's relationship with CFK, it was very easy for us to have this relationship. But I think, you know, one of the things about doing this work, I think, is when you're starting out any partnership is to have very open, transparent conversations about just from the very beginning and asking people what their priorities are and making sure that that's what's guiding this work. I mean, I think in all of my, you know, a lot of times there are these huge issues around like budgets and where the money is coming from and how this is going to work. And so I think being very transparent about how much money is going to UNC, how much money is going to CFK, making it clear from the beginning, talking about, yeah, and I think really, I mean, and also other things like having very open conversations about authorship and making sure that we are doing things in an equitable and transparent way. I guess that would be how I would start. But I think there's, I don't know, I feel like just also, I don't know, I guess in the years of doing this work, I think trying to approach it from a place of humility and understanding that, like, thinking about what my role is in this work. I mean, my role, I think, is to help bring resources to this work. I'm not, you know, I'm not the person collecting data. I'm not the person who's leading the dissemination activities. I'm here today talking with all of you, but really, I think of my role as how can I support CFK to be able to reach their goals. And so I think that also helps when building relationships. I hope that helped.
Thank you, Stephanie. I think we have time for one very brief response to Maha's comment. There's a lot of positive comments in chat, and we'll capture those and make sure that you have those. Maha asks, I wanted to ask if you discuss cultural influence on adolescents' diet. I mean, traditions, common traditional dishes or traditional celebrations that include any kind of food that is not healthy.
Thanks for that question. I don't think that we specifically focused on traditional celebrations. We certainly talked about, and certainly adolescents and their parents talked about sort of traditional diets and talking about traditional foods and sort of how those foods are not, when there's additional resources, that those foods aren't prioritized. I think in some of the parents, in some of their focus group discussions, they talked about the importance of going back and making and eating more traditional foods. But it's we didn't really talk about the celebrations. And I think that's something that would be good for us to ask about in our future work. So thanks for highlighting that.
Wonderful. We have one in the chat too from Leonard who says he lived in Kibera, which is pretty cool. Anyway, I want to thank you, Stephanie, for a really interesting presentation. I think we're all going to walk away thinking about a lot of these topics. And thank you all for joining us and asking such great questions. So enjoy the rest of the day, and we'll see you hopefully for the next series.